Hello, professor and classmates. My name is Francis Torres. I'm a student at Chamberlain University College of Nursing, FNP program, currently in NR 507, Advanced Pathophysiology. Today I'll be doing a presentation on rheumatoid arthritis. So what is rheumatoid arthritis? Well, it is a chronic inflammatory disease of the joints that is specific to an autoimmune response that attacks the synovial membrane of the joint. When that inflammation happens, joint inflammation, pain, and destruction can occur. This can lead to also joint deformities and the formation of nodules around those joints and other parts of the body. As the disease progresses, you can have pain, reduced mobility, and you're also going to have some systemic features that are present, such as fever. Treatment of RA can include pain management and anti-rheumatic drugs that will help pain, help the symptoms, and also reverse the effects of the inflammatory process. So what are the risk factors for rheumatoid arthritis? There are several. Some non-modifiable risk factors would be being female in gender, Caucasian, ethnicity, your age. It's more prevalent when you're older, specifically after the age of 60. If you are a female with a history of live births, also if you have a history of osteoarthritis. Some modifiable risk factors include smoking and being obese. Now, the most important risk factor for rheumatoid arthritis is the presence of the HLA gene in a person's genome. This is the main risk factor that causes the activation of rheumatoid arthritis. So how do these risk factors connect to the etiology of RA? Well, as I said, the presence of the HLA genes is what causes the actual activation of that autoimmune response. The activation occurs with the activating of rheumatoid factors. When that happens, immune globulins are activated that target antigens in the synovial membrane of the joint where the inflammation occurs. What are some provider implications for this disease? Well, modifying those modifiable risk factors is what's important. Now, a thing to point out here is that smoking and obesity, which are the modifiable risk factors of RA, are actually the two risk factors that cause RA the most. When a person has the HLA genes in the genome and they have one or the other or both of these modifiable risk factors, it greatly increases the chance that the autoimmune response will take place. So identifying those risk factors is going to be very important for the provider. When a person is identified to have RA, pharmacological treatment early is important to help the progression. Management's very important to help comfort, mobility, and reduce pain. And of course, education is very important to make the patient aware of what they should expect and what they should do to help manage their disease. The progression from the initial injury of RA has many effects to different tissues and organs of the body. So when this inflammatory process happens, it attacks the synovial membrane of the joint. Cytokines produce enzymatic breakdown of the cartilage in that joint, which contributes to the damage. Then you have T cells that interact with symbiocytes, and they create what's called a pannus. This pannus is a collection of all the white blood cells that come in during the inflammatory response. This includes T and B lymphocytes and symbiocytes that go into the synovium, attack it, and cause that inflammatory response. As this response continues, it causes hypertrophy and acidosis within the joint. As progression continues, you're going to have complete destruction of all the joint tissues. It's the cartilage, the bone, everything in the joint becomes destroyed, making it completely immobile. Use of the joint becomes a lot less to none, And with RA, you're also going to have the formation of nodules, which is a collection of cells in kind of a cyst formation that can form on the joint and other parts of the body. With mobility, you're going to have some contractions on the joints, which is caused by the immobility to where you can't move the joint and it becomes deformed. These can happen on the hands, fingers, feet, and even the hips. As it progresses more, it can also progress to some systemic defects. These nodules that I talked about can go to other parts of the body, including cardiovascular valves. They can form on the skin, causing pain and vasculitis. They can also go to the lymph nodes, causing problems with the lymphatic system. You can have pulmonary fibrosis in the lungs, which would give problems with the respiratory system. It can even go to the vessels of the eye, causing symptoms of glaucoma. As with many other autoimmune diseases, there can also be systemic effects. With RA, people can have symptoms of fever and malaise. So here we have a couple illustrations of what RA does to the joint. The picture on the left, you see the collection of all the white blood cells, the lymphocytes, the macrophages, the fibroblasts, all collecting in the synovial fluid and forming that pannus around the cartilage. When you look to the picture to the right, you can see that large pannus to the right there, all formed on the joint, up against the bone, onto the cartilage, literally just inflaming the whole area, causing it to be destroyed and eventually immobile. Here's a picture of the physical deformities that RA can do. You can see the one hand with the subcutaneous nodules. That's one of the places it can form. It can form on the joints of the hands, which is going to cause a lot of pain that's already present from the inflammatory process. But the formation of these nodules can give more pain and immobility to the patient. The picture on the right, you see what the immobility of the hand can do. The hand starts to become deformed. You have some ulnar drift there of the ulnar bone, and you can see how the fingers are kind of turned out due to all the immobility that the patient experiences. The joints become literally unusable. So how do we link these system changes to the presenting signs and symptoms of RA? Well, as I said, when you have that inflammatory process that attacks the synovial membrane, it causes all that inflammation. So you're going to have the swelling in the joints. That's the inflammatory process attacking those joints. You can see it. It's going to become inflamed. It's going to become painful. It's going to lead to joint immobility. And it's going to cause the formation of those nodules that I just showed you an illustration of a second ago. And a lot of those patients will present those symptoms because of the formation of those nodules from the inflammatory response. Again, a patient might present with systemic symptoms such as malaise and fever because of the inflammatory response that is occurring. How can a healthcare provider diagnose RA? Well, in the front end, you're going to see a person first presenting, hey, I've had pain, arthritis in my joints, and arthritis can be caused by many things. Particularly with osteoarthritis, it can be caused by wear and tear of your joints from work or physical activity or age. Now, what's specific to RA is that since RA is an inflammatory disorder, an autoimmune inflammatory disorder, you're going to have swelling everywhere. It's not going to be localized. You're going to have it bilaterally in either both hands, both hips, both feet, both legs. A way to really identify this when a patient is showing symptoms is to do two things. You have imaging through color Doppler sonography and serum lab work. Color Doppler sonography actually identifies the damage that's going on in the synovial membrane, which is the mainstay of RA. With serum lab work, you're going to have an increase in the rheumatoid factors. ACPA, CRP, and ESR. All these serum lab works will be elevated, which is indicative of the presence of RA. And also what's very important is the symptom duration. A lot of arthritis, like with osteoarthritis, pain can come and go. During a flare-up, pain is continuous, symptoms are continuous, and the duration of the symptoms can go on for a very long time. So what are some interventions for RA? Well, pharmacologically, we have a few medications that can help combat the symptoms of the disease. First, with disease-modifiable antirheumatic drugs, these are ones that block the process of the inflammatory response that occurs. This will reduce neutrophil adhesion, inhibit the leukotrienes, inhibit the synovial cholinase gene expression that all occurs during this inflammatory process. You can also use non-steroidal anti-inflammatory drugs and steroidal drugs such as glucocorticoids that both inhibit the inflammatory process of the mechanisms of action, such as the formation of the chemokines and the cytokines and all the other processes that happen during the inflammatory process. Specifically, tumor necrosis factor inhibitors and interleukin inhibitors are two drugs that specifically inhibit those two things respectively, as those are two factors that are also part of the formation of the inflammatory response that occurs with RA. There are also some important non-pharmacological interventions for RA as well. What's really important, hand and joint exercises. As I said earlier, there's a lot of joint deformation, immobility that occurs. Keeping up on the mobility of those joints can increase mobility, prevent deformation, such as with that ulnar drift. Overall physical activity is important. Number one, to keep from deformations from happening, and also to reduce weight, because as I said, obesity is a big risk factor that helps activate the inflammatory process. Having a proper diet, same thing. Keep your weight down, prevent obesity. You can prevent flare-ups from happening. When a flare-up does happen, you have therapies such as with cold packs or ice massage that can help reduce the pain and inflammation. TENS is a electrophysical therapy that can kind of help with the pain sensation. And then the use of assistive devices such as with splints can help preserve mobility with certain amounts of inflammation. Let's say in your arm and your leg, splints can kind of help keep the formation of that joint and kind of prevent deformation from occurring. So to summarize, again, RA is an autoimmune disorder. It happens with the presence of the HLA genes in the person's genome and are activated by risk factors, especially that of obesity and smoking. As the disease progresses, you're going to have joint destruction, joint swelling, deformities, and eventually loss of the joint and limb function. Most important signs and symptoms: the joint swelling, stiffness, and immobility. You're going to have those nodules forming in different parts of the body, and you're going to have those overall effects of the fever and malaise. Ways to diagnose: you got to identify these symptoms. When a provider does, Doppler sonography, identifying the damage in the synovial membrane, and serum lab work, identifying all those specific serum laboratory data that shows increased when RA is present, is important in diagnosing. Once we do have a diagnosis, the treatment with all the anti-inflammatory drugs that inhibit and reduce the inflammatory response by the immune system is important in reducing RA's effects. And using cold applications, exercise, and splints all helps the problems of joint pain, deformation, and immobility when the disease progresses. So what are the implications for the nurse practitioner? Well, As I said, rheumatoid arthritis goes way beyond your joints. You have all these systemic effects. You have effects that can affect the whole body. And then you have a patient that's experiencing a lot of immobility and pain. So it's going to be important for the nurse practitioner to have many healthcare resources. You know, with a patient that's going to have problems with heart valves, you know, you got to provide them resources for cardiac health. Problems with the eye, ocular resources if they're having problems with that. Physical therapy if they're having problems moving around, using their arms, legs, hips. What's also important is follow-up by the nurse practitioner. As I said, RA is ongoing. It's a long, ongoing disease that'll keep going. Flare-ups will continue to happen, so it's important for the nurse practitioner to keep constant follow-up on their patients, see if their disease management is doing well, see if everything that's prescribed is helping them, so if any modifications need to happen, they can take place. Lastly, disease education, very important for the patient. Many people might confuse this with osteoarthritis. Others might have no idea what's causing it. So it's important to educate the patient. Why is this happening to them? How is it happening? And then beyond that, what they can do to prevent it and to maximize the use of their joints, their limbs, and to maximize their health altogether during flare-ups, and things to do to prevent flare-ups. That concludes my presentation on rheumatoid arthritis. I would like to thank my professor and all my classmates for watching, and I wish everyone luck in the rest of this class and the rest of our program. Thank you for listening.